when Lyme disease doesn't look like Lyme disease. I get asked this question quite often. This is part of the Common Sense Lyme series where I discuss questions I see and patients I see in my practice. Now, the expectation for a lot of doctors, and this is because that was the original description of Lyme in Lyme, Connecticut, was that you would get an erythema migrans rash, a swollen joint, particularly the knee, and heart block, and you'd have a tick beforehand. My patient had none of these. Instead, he had brain fog, which is processing concentration problems, fatigue. He had POTS, the positional orthostatic tachycardia syndrome, which is a diagnosis that you often pick up by the cardiologist because there's pulse changes when you move. But autonomic issues are also involved in the sensory system, which he had, and the gut issues, which he also had. He went 11 months without being diagnosed. What was missed is he didn't see a tick, didn't have the classic symptoms and signs that I talked about, and therefore, missing those pieces, he ended up not realizing that you need to make a diagnosis of Lyme disease on other criteria also. So the commonly missed symptoms are brain fog, dizziness, which sometimes meets the criteria for POTS, sleep issues, mood issues, fatigue. But there's others on the list like painful neuropathy, gut issues that might be constipation, sensory issues where they might have problems with sensitivity to light and sound, heat and cold, even smell. There's a variety of neurotransmitters that affect the mood. So you can have a wave of anxiety, sadness, despair, and irritability. The turning point for this gentleman was he was finally tested. He was treated because he actually had a positive blood test. Now, I have a lot of patients who don't have positive tests, and I have to use clinical judgment. He started improving, and he said, I wish I had known sooner. In other words, he wished that he had known that there was other issues beyond the rash, beyond the tick bite and the swollen knee. So the takeaway is that Lyme disease is still a clinical diagnosis. The tests aren't that good, so even if the tests are negative, it's still important to do clinical judgment. Don't wait for the classic signs because it often might lead to more chronic issues and more complicated treatment protocols. And that's always frustrating for patients. Even if they get better, who wants to suffer for 11 months or however long that you suffered? Thank you for joining me for this Common Sense Lyme discussion. Have a good day.